A surgical team in Saudi Arabia have carried out the world's first fully robotic heart transplant. The operation lasted roughly 2.5 hours. It was performed on a 16-year-old patient with end-stage heart failure. The patient had requested the heart team not open up his chest. Speed, of course, of the essence. The surgeons at the King Faisal Specialist Hospital and Research Centre in Riyadh had practiced 7 times to get it right. But what does it mean for the patient? Well, it means reduced pain, shortened recovery time and a much lower risk of complications. Let's speak to the man who led that team. He is Dr. Faraz Khalil, who led the surgery, and he is head of cardiac surgery at the King Faisal Hospital. It's lovely to see you. Many congratulations on an extraordinary achievement. I've got to ask the obvious layman question. How does a robot handle an organ as sensitive as a heart and get it into the cavity with such speed?
Well, good afternoon and good evening, ladies and gentlemen. Thank you very much for hosting me at your show. Just to answer you this question, it is rather delicate, but after having above 400 of cardiac surgical procedures, we did develop the know-how to handle delicately these organs, especially when we conduct robotic coronary artery bypass, where you deal with less than a millimeter in diameter of vessel and lumen, and threads are not seen by the bare eye. So honestly, especially with this, such as a robotic heart transplant, performing it has to be practiced prior to conducting.
And are you doing all of this by video? You're doing it remotely by looking at the video?
Correct. So the robot has a console, and the console is the controller of the main robot, and the main robot becomes or gets docked next to the patient through 4 arms that goes between the ribs. Each arm has 8 millimeter in diameter with the width, and the length goes up to 45 or 47 centimeter.
That is extraordinary. And what do you plan to do with this now that you've perfected it?
So first of all, we have to continue doing it and develop knowledge transfer. We need to invite all robotic cardiac surgeons who are experts in the field from all around the world and bring them over first into our research center to conduct it as an experiments, and then we give them a case observation.
And your patient is already back on his feet, is he?
Oh, yeah. I mean, the patient from day 1, he was extubated and start to eat and drink and talk to his family. From day 2 and 3, start mobilizing, rehabilitating. And day 4, he left the ICU.
After day 4?
Correct.